Look like you've got it all set up. It looks perfect. I said the only thing, when they said that Margaret was sick and couldn't make it, and Tracy says, well, something, oh, you try to get it all lined up and everything. I said, yeah, the next thing that these guys do is that has been AV disaster. I mean, that's what in classroom, that's what always happened. I was always calling. I had everything set up, and then I called, begin class. I had to call ITS and come over because the computer wasn't working that well. And generally it was me.
Good morning, everyone, and welcome. I invite you to please stay seated as we welcome the Orange County Masters of Science in Nursing Cohort 12 and Masters of Public Health Cohort 2 to enter the auditorium.
Waking up in LA, sleepwalking on another big stage. You never reach to hear people scream.
Thank you. Good morning, and welcome honored guests, family, and friends to the University of San Francisco's Orange County campus Master's Entry, Masters of Science in Nursing pinning, and the Masters of Public Health Stoll presentation ceremony. As you can see, this is a day of celebration. Today, we're delighted to join in the celebration to honor the graduates of both our MSN and our MPH program. I'm Dr. Annette Regan. I'm the faculty lead for the MPH program in Orange County. And I'm joined here by Dr. Mohammed El Najim, who will be introducing for MSN.
Good morning, everyone. My name is Dr. Mohammed El Najm. I'm an assistant professor here at ME-MSN program in Orange County. Also, I'm representing Dr. Margaret Santantia. She's our leader. She's our boss here. Unfortunately, she's not feeling well today. Pinning is a symbolic ceremony that welcomes newly graduated students into the nursing profession. It marks the end of a very rigorous education program and the beginning of a life of service to those in need in our communities. It's a time-honored tradition that new graduates look forward with excitement and pride. This is a solemn ceremony that represents a nurse's entry into a lifelong journey of service to the community. I'm honored to introduce Father Tim Godfrey, who will say our prayers this morning. Father Godfrey is a priest and a nurse who has joined us in OC campus. Welcome, Father Godfrey, please.
In Psalm 118, the psalmist sings, "This is the day the Lord has made. Let us rejoice and be glad in it." So let us rejoice then and be glad as we pray. Loving God, you have made us so that we may share in your joy, to live lives of praise and thanksgiving as we come to an ever greater awareness of the richness of your goodness, the breadth of your mercy, and the strength of your love for each one of us. No matter what the circumstances, in our laughter and in our tears, in our struggles and in our successes, you are there, always faithful to us, calling to us by our names. On this day of celebration, we gather to rejoice as friends, families, administrators, staff, and faculty in the accomplishments of our students have achieved through hard work and perseverance, and their growth that has been nurtured through love and commitment, and the wisdom that they have gained through professional dedication and rigor. We also rejoice because you have been present in it all. It is you who have mysteriously but surely brought us all to this moment to witness the miracle of new life. A new cohort of master's prepared health professionals is about to be sent forth from the School of Nursing and Health Professions to care for your people, especially those who are most vulnerable. As we continue with our celebration, bless this gathering and increase our joy, for truly today, this day, is made for joy and for gladness, because these young men and women are blessings to each of us both now and to the many people they will serve in the future. We make our prayer thankful for your faithful love for each of us, both now and forever. Amen. And now I'd like to call our Dean, Eileen Fry-Bowers, to please come forward and to welcome all of you.
Thank you, Father Tim. Good morning, and congratulations to our MSN and MPH graduates. Thank you for inviting me to be here to celebrate your accomplishments. Although the completion of any educational goal is worthy of celebration, in today's world, our students deserve so much more than the usual accolades. The challenge that our learners have faced through COVID, current political, societal unrest, wars, disasters throughout our nation and globally have created many unique challenges for so many. The commitment of our learners to their chosen professions of nursing and public health and to their own professional growth is exceptional and honorable. And again, I offer my heartfelt congratulations to all of you, and that includes families and friends who are here to support them today, because without you, we know the journey would be much more difficult than it has been. I am proud for each one of you and for our professions. You are the past, the present, and the future backbone of the United States health system, and perhaps the global health system. Importantly, I use the term health system as opposed to healthcare system, because if we are truly to meet the future that our nation needs, we need to create a system that prioritizes the development, promotion, and maintenance of the health of its population. As some of you may know, I completed my first year as dean at the University of San Francisco School of Nursing and Health Professions on July 1, so I've been here a little over a year. And over that time, I spent my days and hours and minutes learning about the School of Nursing and Health Professions. And I am most impressed to see the mission of the school embodied in the work and accomplishments of our learners, faculty, and staff. We truly improve the health of all populations through equitable and compassionate service, value-driven research, and innovative education of nursing and health professionals, preparing them to use their hearts, minds, and souls to change the health of the world. Recently, I read an article, as deans are supposed to do, from the industry journal called Inside Higher Ed. The article titled 5 Essential Ways of Knowing and was written by Ben Harley and Maz Ahmad, and asserted that if our learners today are to tackle the complex challenges of the 21st century, they need a variety of skills that allow them to go beyond critical thinking. The authors advocate for preparing learners with more holistic critical practices, to which they refer to as the 5 ways of knowing. To start with, number 1, our learners need critical thinking, which they define as a person's ability to evaluate data, make connections, and draw conclusions in a rational and unbiased manner. Second, learners need critical feeling, which refers to a person's ability to both regulate and utilize their emotions to know more deeply. Third, they need critical imagination, which is the ability to imagine worlds and experiences that are different from the ones that currently exist. They need to be able to critically engage. In other words, they need to be able to discuss their ideas with others and to explain their reasoning. And lastly, they need to embrace the idea of critical being, which refers to a person's relationship with the world. Critical being acknowledges that individuals are co-created by a whole host of factors, including their engagement and experience with other people, events, and circumstances. In the words of the authors, cultivating critical skills means acknowledging all the things that co-create who we are and how we think. I share the words of these authors with you today because their message is entirely consistent with the Jesuit values that underpin the education provided by the University of San Francisco. Your graduate nursing and public health education has emphasized the care of the whole person. You have learned to advocate for and design health promotion and risk reduction services for diverse populations, communities, and the health professional team, to provide education to individuals, families, and other healthcare providers, to improve patient care and safety, clinical outcomes, and unit efficiency, to reduce costs and improve standards of care with the use of evidence-based practice, and to coordinate highly functioning teams. You have learned a lot. In other words, consistent with the Jesuit tradition, your educational experience has provided you with the opportunity to lead and accompany others in the creation of a more humane and just world, to see the inherent dignity in and holistic potential that exists in all people, to respectfully acknowledge differences of perspective and preferences and seek a common understanding and interest in order to cultivate collaboration and relationship building, to value courageous self-reflection, creativity, and innovation, which are qualities that are so essential for excellence and transformational problem solving. You will focus and have focused on the interconnection and interdependence within humankind and within the natural world, and practice engaged citizenship and stewardship in a service to a greater world. You have expanded your ways of knowing, and through your thinking, your feeling, your imagining, your engaging, and your being, you will take the art and science of public health and nursing to new levels. As I noted at the beginning of these remarks, you as a cohort have overcome the ongoing challenges of an ever-evolving world. Although you may have experienced and may carry mental, physical, and spiritual wounds of these experiences, I sincerely hope that you have also come away knowing that you are strong, you are capable, you are resilient beyond measure. I also hope that you have learned more about yourself and that you have embraced self-care and that you take concrete actions to heal yourself and heal with peers and colleagues. You deserve that. Remember that. You are all leaders who have risen to the occasion, and boy, do we need you now more than ever. The pandemic has laid bare the significant shortcomings of the current U.S. health system, which relies on a model that promotes reaction to illness and injury rather than the development, promotion, and maintenance of wellness and good health. As nurses and public health professionals, we know that the key to improving the health of individuals, families, and communities is to address structural and social determinants of health and to provide effective, efficient, equitable, and accessible care for all across the care continuum and throughout an individual's life. We also understand that we play an essential role in identifying the system facilitators and barriers needed to achieve this goal of improving health for all. Through your perseverance, hard work, and dedication, you have prepared to lead and succeed in today's complex and dynamic healthcare and public health environments. Thank you. Thank you for your dedication to growth, excellence, and professionalism in the health professions and nursing. I wish to each of you the best of luck and the brightest of futures. Thank you.
And now I would like to introduce Dr. Ryan Homani, our faculty speaker for the ME-MSN program. I definitely appreciate that. And I definitely appreciate being your faculty speaker. I mean, I don't really know why you want me to speak any more than I already have. Let me tell you guys, we're in class 3-4 hours, and we use every minute of our time. So if they want me to speak a little bit more, to each his own. I think that's all I have to say. I want to tell you what's not lost on me. It's really not lost on me what it means to consistently receive support, like you just saw, and praise, probably overly generous praise from your cohort. So I really appreciate that. The only reason I teach is because you, the students, because I have your support. And for that, I sincerely thank you. As you guys know, as most of my students know, I don't teach any leadership classes, and probably for very good reason. One of the few leadership principles that I have taught was no leader can be successful without the consent of the governed. Okay, we always need the support of our team. No leader throughout history has ever been able to effectively do that. As your cohort starts to assume leadership positions, keep in mind you will never be successful as a leader if you do not earn, and yes, earn, the support of your team. And at some point you'll learn you're only as good as your team. The little success I've had in teaching is not due to any individual prowess, but rather constant support from you, the students, and now colleagues. Throughout pathology, MedSurg 1, MedSurg 2, everyone here has always done and always did it was big, no matter what was asked and no matter the task. I mean, how can I lose? I definitely want to thank the university for getting me the best and brightest, and that's definitely not hyperbole. If anybody in the audience was able to see their HESI scores, it's totally not rhetoric and totally not hyperbole. The other individual point and the other important point when you go off and start your careers as registered nurses and go off into your units is to understand the value of your MSN. And that big value is to be able to recognize that our institution of healthcare needs to improve. And of course, that you need to do something about it. Of course, to affect change, you must be willing to challenge the status quo. Poor outcomes and unequal outcomes will never improve if we simply do what has always been done. I would hazard that most people here wanted to become nurses to advocate for vulnerable populations, advocate for more equal outcomes between different groups. The question then becomes, how do you change nursing practice and address disparities that everybody claims to abhor? How do you change the institution of healthcare? That's a very difficult question to answer. And what do we do when we don't know the answer to a question? We invert, just like on your exams. For anyone in the audience who's never taken one of my classes, the first thing I teach a student, if you don't know the right answer, look for the wrong answer and identify the wrong answer and eliminate it. So if the question is how to improve, the wrong answer is definitely to do nothing. Challenging the status quo does not mean you are anti-science. It is the most pro-science thing you can do and the best thing you can do with your master's degree. Just to give everyone context, back in my day, the science recommended that all Americans get 6 to 12 servings of starchy carbohydrates every day and to avoid natural fats. So, like good pro-science Americans, everybody loaded up on carbs and margarines. We stopped eating avocados and peanuts and loaded up on, I can't believe it's not butter. I'm sure most people in the audience are going to remember all that. That was the science, so don't be anti-science. Actually, most of us weren't anti-science. Okay. So how did that turn out? Not so well. So what did it take? It took one brave healthcare professional to stand up and say, hey, this isn't right.
and it definitely wasn't right. So you graduated. Now what? Now it's your job to be that healthcare professional. And as this university would say, change the world from here. Notice even how our liberal friends at USF use the word change in their slogan. The first and most important word. So yeah, go change the world from here. Thank you. So before I go, I would like to introduce the ME-MSN student speaker, Destiny Navia.
Sorry, can you guys see me? No. I was just talking to this iPad. Okay. Thank you guys for coming. I'm going to start this session. Friends, family, faculty, staff, and students, welcome to the University of San Francisco's Master of Public Health and Master of Nursing pinning ceremony, and thank you for taking the time to celebrate our accomplishments today. For those of you who don't know who I am, my name is Destiny Unavia, as Dr. O'Malley said, and I'm a member of OC12's nursing cohort. I've had the privilege of holding the positions of class representative and the president of the Orange County Graduate Nursing Association. Today is the day that I've greatly looked forward to and deeply dreaded the most. Today is the last day that I have the honor to be in the presence of 22 of the most amazing nurses I've ever met. Sorry. From semester 1, when we were so timid and confused about what the heck an SBAR even was, to semester 2, when Dr. O'Malley began consistently referring to Veronica as Miss Williams and Giselle as Gazelle. To semester 3, when Dr. Muhammad had to listen to Rick sing a whole minute of Love You by Mario before his research presentation. To semester 4, when we all enviously watched Brianna walk out of the room 25 minutes after starting our med-surg HESI exam and finding out that she later passed with an A, as always. To semester 5, when we achieved one of Orange County's highest all-time exit HESI averages, and some of us were even able to witness Esther's amazing skiing skills. To semester 6, when we completed our quality improvement projects and celebrated all of our accomplishments. I'm so proud of how much we've grown. Some of us worked per diem to full-time jobs. Some of us took care of our family members and had children along the way. And some even commuted 2 hours one way multiple times weekly to complete our degree. We've shed so many tears of both defeat and joy, laughed hysterically, and celebrated each other's accomplishments. With our incredibly strong desire to succeed together, we have truly conquered all. The University of San Francisco emphasizes the importance of changing the world from here, and I believe that we completed just that. With the help of our professors, clinical instructors, and staff, we've been able to facilitate change all around us. When looking back at my time here at USF, I think mostly about the hope and light we've brought to our communities and each other. From hospitals such as UCI Medical Center and Children's Hospital of Los Angeles, to community health programs such as Project Access and Mary's Kitchen, this cohort alone has positively impacted and saved the lives of hundreds of people. We have administered injections, practiced wound care, implemented quality improvement projects, fed the homeless, and provided education and activities to low-income families within 2 short years. I cannot imagine what more we will be able to change when we begin our careers. I'm so blessed to have completed this long, draining, wonderful journey with you all. In the beginning of our program, 2 years seemed like forever, but now it feels too short because I'm not ready to say goodbye or see you later. I did not expect to create such a close relationship with each of you, and sometimes I wish I hated you guys so our end wouldn't feel so bittersweet. Nonetheless, I'm so excited to see how much more we accomplish after we part ways. You guys will forever hold a special place in my heart and will always be considered my brothers and sisters. I'm so incredibly proud of all of us and all that we've conquered together. Without you, I would not have survived this program or even enjoyed my journey here. Now let's finally celebrate graduating our Master of Science in Nursing and Public Health and continue changing the world. Let us do as Dr. O'Malley says and go do something other than nursing school.
Thank you for those really inspiring words. I now have the honor of inviting our faculty speaker for the Masters of Public Health speaker to come and share some of his insights. Please join me in welcoming Doug Morales.
Good morning, everyone. Really happy to be speaking, representing the MPH program. Got to know Honorine and Antonio quite well, and I'm extremely excited for their future, their endeavors. Seeing my graduation today reminds me of when I graduated from my MPH program and all the hopes that you carry in the prospect of a brighter future, not just in the economics of matters, but as a joke, I always told students that an MPH stood for Masters in Poverty and Humility, but in reality, it's such a worthwhile degree. You'll be able to work at every level of government, local, state, federal, health insurance companies. So the MPH program has opened up my world. And with your background now in geographic information systems, you'll definitely make an impact. Tom Frieden, former director of the CDC, stated that he loved clinical practice, but public health, you can impact more than one person at a time. So the whole society is your patient. So as you go out into the world and venture in different roles, just know that your patient is the whole world. And the best advice I can give you for your career is a biblical scripture, and I quote Philippians 2:14, do everything without complaining and arguing. So I wish you the very best in your endeavors. Always know that you have me as a resource. If you ever need anything, you have my contact information. So I'd be more than happy to provide a lifelong mentorship to you. Honorine and Antonio, very proud of you for your accomplishments. Thank you.
What a groundbreaking stride we've made up here. Dean Dr. Freiber's School of Nursing and Health Professions faculty, families, mentors, friends, Sisters of St. Joseph of Orange here present today. I'm so honored to stand here, and I honor your presence. I felt the energy of the divine in us and with us today, and a host of those who witnessed and affirmed our education journey, but are far from us today or no longer with us in this life. I'm Honorine Uwimana, and I'm a Master of Public Health. And this is the first of the many times I'm going to introduce myself as an MPH. I was born and raised in Rwanda, and I call Sub-Saharan Africa home, and South California my second home. Home, Sub-Saharan Africa, ranks first when it comes to the lowest improvement in life expectancy. It has the highest burden of disease and health outcomes. And I grew up along those axes of inequities in a perpetual state of acute crisis. When it wasn't the heavy toll of the HIV epidemic, it was Ebola outbreaks, post-colonial wars, undernutrition and famine in the eastern side of Africa, and the danger of being a child in a landmine zone. Identifying with the numbers on the charts and dashboards of global health made me realize that I was blessed to witness yet survive the miserable determinants of health that prevail in sub-Saharan Africa. I found myself under the imperative to denounce systems and conditions that allow such systems of inequities to persist. My story is also your story. There is a neck, a long dip that brought you to the School of Nursing and Health Professions. And here we are today, after so many ebbs and flows. We started the program at the junction of so many icks, isms, and phobias. The COVID-19 pandemic, the opioid overdose crisis, mental health crisis, loneliness, the upheaval, structural, and systemic racism. And here we are today. Congratulations to us. What we celebrate today is our resilience, is what we have made of our own brokenness in the last years here at USF. At the example of the valiant women, some of them here present today, the Sisters of St. Joseph of Orange, St. Ignatius of Loyola, wonderful patron to the Dons. We are leaving USF with the devoir to connect the charisms of Christ to the needs of the community. We spent our academic years challenging inequities, and the time has come for us to be challenged and go and instrumentally manage the inequities in our communities. As we climb upper echelons and dive into new beginnings, we are all grappling with big decisions about what's going to be next, or maybe what's going to be best. Fellow Dons, when time comes and fear steps in, or shame takes over, when you feel mentally tired to keep moving, I hope you do not become a stranger to your own courage, because that's why you are here today. I hope you do not become a stranger to your story of resilience, to your unique gifts and goodness. When that time comes, I hope that you take a break if you have to, you reroute if you need to, but keep moving, keep weaving the dream forward. To our faculty, thank you for making complicated concepts understandable and exciting. Thank you so much for raising the altar of daring. Whether I was in the skills lab, in room 202 or in room 203, thank you so much for challenging us to go and change the world from here. Dear Dons, let us step out of this auditorium to sharpen our academic excellence into resolutions for health equity. Or probably, as Father Greg Ball would put it, let us join the easily despised and the readily left out. Raise a banner to stand with the demonized so that the demonizing will stop. Let us go situate ourselves right next to the disposable so that the day will come when we and our systems will stop throwing people away. And by doing so, I hope we find true meaning and fulfillment with confidence that the Supreme God who began this good work in us will carry it on to completion. Now, let us set a crown upon our efforts today and start to repair the world from here. Congratulations and thank you.
Thank you, And now I'd like to invite the ME-MSN students to come to the stage for the pinning. Family members who will be participating, please line up on the other side of the stage. Destiny Unavia. Unavia and Dwayne Unavia. Brianna Cates. And by Giza Cheretz. Lisa James. And by Tina and Kevin. Mira Tolentino. And by and Oscar. Gabriela Garcia. And by her sister Isabella Garcia and parents. Caroline Slaughter. And by Zach Slaughter. Gonzalez, pinned by her and father Jose. Denise Espinosa, pinned by her mother, Luisa, and sister Arlene. Rosa Peniagua, pinned by her sister Melissa Peniagua and her mother Marlene. Ashley Sampson, pinned by father Ed Sampson and mother Lucy Sampson. Veronica Williams, pinned by fiance Rudy Delia. Nicole Razi, pinned by mother Jacqueline Razi and dad Barry Razi. Joelle Ochoa, pinned by mother Edith Ochoa and Rick Newen, pinned by mother and father and girlfriend Kathy Beers. Matthew Ng, presented by his mother, Fanny. Russell Hall, pinned by Mother Lori Hall. Jane Kwok, pinned by her sister, Shira Kwok. Erica Kim, pinned by mother and father, Jenny and Kwan Kim. Esther Lowe, pinned by husband, Daniel, cousin Michael, father, Dr. Olakunle, and aunt Elizabeth. Trinidad Godfrey, pinned by Grandma Susie, Aunt Nikki, and son Tedman. Refugio Cisneros, pinned by husband, Jackson Cisneros, and brother, Armando Martinez. I will now invite Dr. Al Najim to lead the Nightingale Pledge.
I will do all in my power to make and maintain the highest standards and practices of this noble profession. I will hold in confidence all personal matters committed to the keeping of the practice of my calling. I will constantly endeavor to increase my knowledge and skills in nursing and use them wisely. I will openly collaborate with other professionals in the medical community and devote myself to the welfare of those placed in my care. I will seek to nurse those who are ill, wherever they may be, and whenever they are in need. I will endeavor to fulfill my rights and privileges as a good citizen and take my share of responsibility in promoting the health and well-being of the community. I will be active in assisting others in safeguarding and promoting the health and happiness of all humankind.
We now invite the MSN graduates to take their seats, and we'd like the MP students to come line up.
Antonio Rodriguez. Honorine Oymana.
Thank you. Our public health students will now read the public health oath. Health is a human right, and the mission of public health community is to protect that right. Through science, practice, leadership, and collaboration, we can accomplish this goal. As a new public health professional, I declare the following: I will change the world from here and work to improve the health of local and global populations, particularly historically and systemically disadvantaged communities. I will hold myself to the highest ethics, standards, values, and responsibilities as I advance the science and practice of public health. I will respect the rights, values, beliefs, and cultures of the individuals and communities with whom I will work for and with. I will rely on evidence to support my decisions and actions and translate that evidence into policies and programs that improve health for all. With this oath, I commit to the ideals and mission of public health. I'd now like to invite Father Tim Godfrey to come back to the stage for closing remarks.
Being new to the campus, it's such a privilege to be with all of you And I have to say, I've been so impressed with what I have seen of this cohort here, of both our nursing students and our public health students. Thank you so much for allowing me to speak to you and to your families today. First of all, I want to say congratulations to all of you who have completed your programs. And the second thing is to say thank you, both to our Masters of Nursing students and our Masters of Public Health students. This is an exciting day for you, for your families, and for us at USF. Through your respective programs, you have completed a rigorous process of education and formation guided by your faculty and staff. Now, as you become alumni, you join an impressive community of peers, other USF health professionals who are dedicated to improving the delivery of health and consequently health outcomes for a diverse array of populations. They are a community that expresses in concrete and creative ways our Jesuit values of cura personalis, care for the whole person, of being people for others, and of being contemplatives in action, people who see beyond the superficial to the deeper human and transcendent realities at play. For example, we have alumni who have founded organizations that establish collaborative networks of private and public agencies to assist those who have been incarcerated, allowing them to make the successful transition to society once again. There are alums who are doing advocacy, policy work at the state government level, so youth who have substance use disorder can overcome legal barriers to receive needed medical treatment. Then there is someone like Jennifer Moreno, a 25-year-old nursing graduate and Army nurse, who volunteered to be part of a special operations cultural support team to reach out to Afghani women, but was killed in 2013 when her unit came under attack and she stopped to care for a wounded companion, triggering a hidden IED. Jennifer was posthumously promoted to the rank of captain, and the primary care clinic at Fort Sam Houston in San Antonio, Texas, was renamed in her honor. This past December, the VA hospital in San Diego was also renamed in her honor. These are just a small representation of alums who make up the community of healthcare professionals who are people for others and who, in their own ways, have and continue to provide care for the whole person, cura personalis, especially to those who are marginalized or most in need. This is a community to which you now belong. We look forward to see how each of you, through your dedication, care, and professionalism, in small ways and perhaps in large ways, continue to work creatively to change and improve the delivery of health, giving special attention to those who are most vulnerable and in need of your compassion. Again, congratulations to you and to your families, and may God bless each one of you.
This concludes the formal proceedings of our ceremony. I would like everyone to remain seated while we welcome our MSN Cohort 12 and our MPH Cohort 2 to exit.
Thank you, everyone.